order. We now come to the community and social session of this reverse select committee. And I should add the note again for the new members of the House that have joined us that this is not an official proceeding of Parliament, and therefore you're not covered by parliamentary privilege, despite the fact that it is being broadcast on Parliament TV. And we have with us representatives from Mumsnet, from Money Saving Expert and Shout Out UK, who are also distributing it through their membership. Well, welcome to Helen Hayes, who is the chair of the Education Select Committee, and to Lord Foster, who is chair of the House of Lords Justice and Home Affairs Select Committee. Thank you for joining us. Our questioners around the table will put their questions to you, and then we will just allow you a very short couple of minutes to answer each one. Thank you. We'll start with a question from Kelly Foster, who is a mother from Durham.
There. My question is, through lived experience, I understand the impact of domestic abuse. I want to see how Parliament is ensuring the policies to reduce domestic abuse and violence against women and girls are working. What evidence is used to guide policies aimed at reducing violence against women and girls?
That's the question I'll put to you, Lord Foster.
Well, thank you very much indeed for the question. The Select Committee on which I serve and I'm the chair, Justice and Home Affairs Committee, has not looked at this issue in recent times at all. But it does give me the opportunity perhaps to just share with you, were we to choose to to look at that, how we would go about it, because I think it's important for people to understand the mechanics of it. Decisions as to what we look at are decided by the committee, and obviously we'll get advice about from a range of people who will lobby us, and occasionally, very occasionally, even a government minister may whisper in my ear and say, look, we're having a problem here, it would be helpful if your committee could look into it. Having done that, what we've decided to do it, we'll have a look at what the area should be, because you can't necessarily cover everything in total. So what we then do is put out a call for evidence. We would go to the specialist media who would be interested in this, say we're going to do it, and if people want to write to us, let us know. We then will receive lots of evidence. We'll do everything we can to publicise what we're doing, get as much evidence in as we can. We'll then invite some of those people to come and give oral evidence to the committee and look in detail at that. Then we'll get a minister to come, a relevant minister to come at the end of our inquiry, the last person we'll talk to, raise issues with the minister. Then we'll go away for several weeks working on the report that we'll bring forward. And a bit later on, I hope we'll have the opportunity to perhaps mention what we would then do about it, having produced the report. The real danger for all select committees is that a report, they get a government response, may have a brief debate in Parliament, then it sits on the shelf and little or nothing happens. And that's the big issue that we have to find better ways of addressing. There are some good examples now what select committees are doing to try and keep the flame alive of their recommendation. Hope that's helpful. I'm sorry it's not on the specific issue you raised, but it's not an issue we've looked at.
Okay, thank you.
Thank you. That's rather useful to know, I think, coming back around to look at what's happened to previous investigations. A current theme, actually, of many discussions. We have a question now from Sage Patel, which is being read out by Shout Out UK, which is a youth participation organisation that's helped to generate questions for today.
Hi, my question's about, we now have a link between rising mental health issues and incidences of self-harm and addiction. Are policies for keeping children safe in education updated to reflect the link between these two? Are we sure schools are equipped to ask the right questions? And is Parliament equipped to ask the right questions?
Wow. 3 questions in one, Helen Hayes.
Thank you very much. So I'm Helen Hayes, I'm the chair of the Education Select Committee, And we are a cross-party committee of 11 members of the House of Commons. We are proportional to the House of Commons, so we have a majority of government Labour members of Parliament, and we have 4 members who are members of opposition parties, 2 Liberal Democrats and 2 Conservative members. And our role and remit is to scrutinise any aspect of the Department for Education's policies that we want to. We run a schedule of subject-specific inquiries where we delve into the evidence and we work out what, as a cross-party committee, we can agree based on the evidence, and we make recommendations to the government. We also hold accountability sessions with ministers at which we can we had one of those last week with the Secretary of State for Education, at which we can raise any topics that we want to. On the issue of mental health, so this will be important to the committee in this current Parliament, because the government has made some really big commitments on the issue of mental health in schools. So the government has a commitment to put mental health professionals into every single school, and also to create open access mental health hubs in every community. And the evidence on the deterioration in children and young people's mental health in the UK is really clear. We have there's evidence that we have kind of the worst mental health amongst our young people of any European country, and we understand more and more about the impact between poor mental health and engagement in education and attainment and outcomes in education. And the harms extend way beyond the kind of confines of individual symptoms that a young person may be experiencing. So getting that kind of network of support right, so that children and young people are able to access support whenever they need it, whenever the evidence on if you catch a deterioration in somebody's mental health really quickly and you put in place a set of strategies to help them to manage it, then that goes much better than if young people are sat on a waiting list for a very long time waiting for the access to treatment and support that they need. So we will be taking interest in this topic. Mental health is an interesting topic, and it's not alone in that responsibility for delivery rests across different government departments. So while the DFE will be taking the lead on the rollout of mental health provision in schools, it can't really do that without working very closely with the Department for Health and Social Care. And Department for Health and Social Care is responsible for the delivery of CAM services. CAM services are where we know many of the challenges that young people face in getting access to mental health treatment and support work. So I've been having discussions with Layla, who is not here, but who's the chair of the Health and Social Care Committee, about how we can do joint scrutiny as 2 committees on this topic.
That's a very good point. A very good point at which to introduce Andrew George, who is a member of that committee. Layla Moran, who's chair of that committee, is unable to join us today. Thank you for stepping in. Please join us. Just in time for us actually to have a question about the work of that committee. Some of these questions that have come in from around the country are very specific, and do feel free to just explain something more broadly about the work of that committee if it's more appropriate. Before we take this question, can I just say that we have a question from Carolyn Chu Graham, who's from Manchester, about why propose neighbourhood health centres when we have general practice and primary care and general practitioners who manage patients holistically. What's the evidence about that? So we've had quite a lot of questions that have come in around the theme of the next question, which is being read out by Mumsnet.
Hi, this is a question from Sarah Snell, who's a Mumsnet user from Whitchurch. And she asks, how would the committee collect and review evidence on the impact of introducing anaesthesia associates and physician associates roles in the NHS? And where could the committee find relevant data, including cost-benefit analysis for these roles?
Andrew.
Thanks very much. Yes. Well, we have no plans to undertake such an inquiry. And although we've discussed this informally within the committee itself, we would probably look a little more widely and include nursing associates as well. So it's not just those at the if you like, across all clinical roles. In other words, so where we would commence an inquiry is of course looking well, both at the background to the setting up of these roles and the negotiations which were undertaken with the Royal Colleges and the professional bodies which set those proposed the actual associates in place and what has driven them, because quite clearly they are acting in roles which were previously, if you like, part of those which were under registration and therefore operating within the GMC and the NMC. So we'd be looking, I think, at the professional bodies as well as the regulatory bodies, but in order to properly undertake an analysis of the impacts, we know that this created a great deal of controversy within the sector. We know that the BMA, for example, have expressed, if you like, a range of opinions within their membership about the effectiveness and the impact of them. That we'd be wanting to undertake, if you like, an analysis of the impact they've had at the local level. So we'd be looking to local ICBs to provide us with the evidential, if you like, both background justification for use, the extent to which they've been rolled out, and the impact that they've had in the last 5 to 10 years. Thank
you very much. We'll take a question now on a subject which I think is quite important to the Education Committee. I want to just flag something that came in from Jason Tracy from Reading, who asked, what evidence does Parliament gather to ensure that Ofsted inspections are valid and reliable? Is there evidence of rapid and sustained improvements that you require for those kind of interventions? And I'm going to take a question also from Ruth Birkhill, who is a retired civil servant from Forest.
What evidence is used to ensure students are exposed to a wide range of views at academic institutions? And how are the curricula assessed to ensure this?
So, Helen, quite a lot of interest in where you're getting your evidence from as a committee and on what?
Yeah, so again, we haven't as a committee looked specifically at issues related to higher education yet in this Parliament, although I've no doubt that we will do so. But in terms of that question, I think there are kind of two parts to it. So the first is the sort of quality assessment of courses in universities and the experience of students on those courses. That falls to the Office for Students, who are the regulator of higher education institutions. They don't quite operate in the same way as Ofsted, so they don't have a kind of inspection requirement, but they do have a kind of regulatory role around the quality of courses. They are accountable to Parliament. So as a select committee, we hold accountability sessions with them. We will shortly be holding our pre-appointment hearing for the new chair of the Office for Students, where we'll be questioning the proposed appointee on their approach to assuring quality across the higher education sector. And then I think the other part to that question is how the government regulates issues around freedom of speech to ensure that students in universities are challenged by a wide range of different perspectives, which might not, some of which may disagree with their own. And what we had last week from the government was a statement on legislation that had been introduced by the previous government and passed by the previous government, and where the new government had taken a decision to review the implementation of that legislation to check that it was going to be effective and that it wasn't going to result in unintended or adverse consequences. And we had a statement from the Secretary of State in the House of Commons chamber last week about that, and essentially, in summary, the government's decided to implement the legislation, but with some changes to the implementation compared with what was originally intended by the previous government, because they didn't think that the kind of balance was quite right in the legislation as it was drafted and originally intended. And then we'll see further information in terms of the regulations being laid down so that that legislation can come into force. As a select committee, we would be looking to the experiences of students, to what academics and university and higher education institution leaders are telling us about the experiences, what the regulator is telling us about the evidence that they are gathering, and about what members of the public want to write to the committee and tell us about. And it's one of the strengths, I think, of the select committee process, that absolutely anybody can write to us and express a view. You can be an individual sitting at home who just happens to have some opinions, and you can write and give your evidence to a select committee. And you can be a regulator with access to every institution in the country, and you can gather your evidence, and there would be an expectation that you submit that to the select committee as well. So that's how we would approach it.
Thank you very much. Very, very welcome explanation about the openness of the committee system to the public. We have a question which is for Justice and Home Affairs that comes via Mumsnet.
This is a question from Gwyneth Lloyd, who is a Mumsnet user from Cirencester. And she says, when prisons are overcrowded and there are issues with drugs and mental health problems, why do we not use restorative justice more? Is the evidence being considered?
It's a fascinating question that you ask, because at the very moment, the Justice and Home Affairs Select Committee is looking into the whole issue of prisons, not all aspects of it, because in fact in the House of Commons, the Justice Committee is also looking at some aspects of prison, so we're coordinating between the two. And the whole issue of restorative justice and its use is again an issue where we're taking evidence, and it may well form part of our subsequent recommendation. So it's a bit early stage yet, but if you've got evidence on the issue and your views on the issue, clearly we would be very keen to hear. If I could just make one other point that I think may be helpful, because most people will be unaware that in the House of Lords, our select committees operate slightly differently than in the House of Commons. Rather than focusing on a single government department, quite often our select committees cover a wider area. They might be just called communications and digital, which could bring in bits from different government departments and so on. Mine is 2 committees joined together. We also have a series of, every year, 4 special committees that last for just 1 year, 1 session, that can take a cross-cutting theme. It might be looking back at previous legislation to see if it's worked well. It might be looking at an issue just like restorative justice or whatever it might be. We recently did very high-profile one, for instance, on highly processed food, which got a great deal of media coverage subsequently. And if you take, it was very interesting, the earlier question, the education question, about mental health, self-harm and schools. One of the key issues that we're looking at in our prisons investigation is mental health issues. So many prisoners have got mental health problems, but specifically in relation to children, we're also looking at mental health problems of people in the young offender institutions, and again examples of self-harm are very clear. So for all of those things we would be looking at getting evidence from people like the Chief Inspector of Prisons, who we're speaking to tomorrow, from prisoners themselves, from people who are residents in young offenders institutions, from the staff who work there, the governors or directors of those institutions, and members of the public, and anybody else, academics. And we also, I think one thing that's not been touched on, at least in this session, the other thing we'll all do in all of our committees is we'll be looking at international evidence as well, because of course this country is not alone in addressing some of the problems that we face, and we're investigating.
In your prisons, in your look at prisons?
Well, in the case of prisons, we know.
Works?
Well, fascinatingly, people may have views about a prison system in Texas where they still have the death penalty, but they provide a very good prison service that does have very low subsequently reoffending. Not from those who've lost their lives, sadly. But if you look at, for instance, the Norwegians, they have a very, very highly acclaimed prison service, and they have a very different approach, for instance, in the Netherlands, where restorative justice forms quite a key element of their system.
Okay,
so
thank you.
We'll look at that.
Thank you very much. And you raised something there that I think before Andrew George joined us, Helen Hayes was pointing out, was whilst you're right, of course, that many of the select committees of the Commons look at the behaviour of departments increasingly, some are cross-cutting, but increasingly they're joining up to look at questions that cut across those departments together. We have a question now from Miles Cheverton from Brighton.
Good evening. It took a 4-year review by Dr. Cass to introduce evidence to decision-making on transgender healthcare. What routes can committees take to ensure that evidence is always considered in government policies, especially on transgender health?
Okay, so that's quite a broad question. Andrew George, I appreciate you've stepped in to Layla Moran's shoes on this, and that's probably quite a tricky question. But I think that latter part of it, certainly, can I put to you about ensuring that evidence is in government decisions. I mean, obviously you look at the work of NICE on your committee.
Thanks. I mean, select committees aren't really there to, if you like, resolve issues of public contention, but to identify really where policy can be either improved or tweaked or challenged, if you like, in terms of the government's approach to matters. So it's not. I think we're kind of aware that there are matters that it wouldn't advance things much if we were to simply sort of go over the same arguments that are going on, if you like, in the public, elsewhere in the public domain. So what can we contribute to this? I mean, what we do, and this applies really across all select committees, is we appoint an expert panel. So the appointing of the expert panel, which of course can be contentious in itself, particularly in an area like this, but making sure that we take a good and balanced approach with regard to seeking to identify the experts to advise us, because obviously we are all lay people coming. I mean, so some come to the select committees, and some are former practicing GPs and nurses and others, people with a professional background, but that's not a requirement of joining the select committee. We come there as policy makers, politicians, people who make policy, and therefore we're seeking advice from those other bodies. So and also there is very little point in us simply, if you're looking at the Cass inquiry and see whether we can actually take it apart. We'd have to be adding something in terms of policy, development, in order to add to the greater good of the public. I mean, select committees do work extremely well together across party, and I think the way that we operate, I think it's true in all committees. When it's in operation, you would not be able to tell which political party any particular member is operating from unless you knew in advance. I mean, if you simply stepped into the room.
That's a very nice point on which to end this second session. We move to our final session of today. We did have evidence, our own expert panel before you joined us, who briefed this committee, including the National Statistician, and we were very grateful for it. Thank you very much. Order, order.